Good morning. Thank you, everyone, for coming in this morning. Swine health remains foundational to the long-term success and resilience of our industry. This seminar will explore both national and Minnesota-led efforts aimed at strengthening swine health through strategic, coordinated action. Please join me in welcoming Dr. Tom Wetzell of the Minnesota Pork Board and For His Kingdom, LLC, and Dr. Dusty Oedekoven, Chief Veterinarian Officer with the National Pork Board.
Well, thanks, Brad. Appreciate the opportunity to speak to you today and give you just a little bit of information on work that I'm doing as a consultant veterinarian with the Minnesota Pork Board on a contractual basis that has to do with improving the Minnesota herd on herd health. And so with that, I'm going to move forward here, and we've got three different topics that I want to speak to you about briefly this morning. The first is just to give you a little bit of update on the U.S. Swine Health Improvement Plan, or the U.S. SHIP plan, and where that's at today and what's Minnesota's engagement and involvement with that so far. And then an initiative that was started last year here at Minnesota Pork Board is the Minnesota Animal Health Task Force that I'm a part of and am facilitating, and give you a little update on what their initiatives are and what's happening there. And finally, an outshoot from that task force has been a Mycoplasma pneumoniae certification elimination project that's starting here in the state of Minnesota, which is pretty exciting, and give you an update on the information that we have so far and where our vision is of where that's going to go in the near future. So with that, just for those of you who don't know, the Swine Health Improvement Plan has been around now for 4.5 years. It is now in the hands of the USDA, and we're waiting for codification or it to become federally registered program that is ran by the USDA. But for the last 4 years, it's been a pilot project that's been run by the volunteers, or not the volunteers, but the people that were contracted to do that at Iowa State University mostly, along with a lot of volunteers in the industry that have been part of that program up to now. And it's based on the National Poultry Improvement Plan, which is the NPIP it's called, and that Poultry Improvement Plan has been around since the 1930s. And it's a voluntary program, and that's what we're doing with the U.S. SHIP program. It's also completely voluntary. It's a certification program based on site certification, and the idea of the program is to make sure that we have still ability to sell our pigs to market in the case of incursion of foreign animal disease such as ASF or hog cholera. And so we're not going to be dealing with the control zone where the animals that are infected are, but outside of that control zone, we still have to have the ability to move our pigs. And so packing plants, livestock haulers, all the people that are engaged in the process can be certified in this program to make sure that we still have an avenue to sell those pigs. And then just as important is to continue with our continuity of our export market. That's a big part of who we are, and if we lose that export market with an incursion of ASF, we can be in significant financial trouble here. So the idea there is that by having certification with a USDA label on it, that we're still able to do that with our trade partners. And the poultry industry has proven that that works. They developed a really strong program as part of their NPIP with high-path avian influenza, and when they developed that after this last break, they were able to maintain their exports at a very high level, even from before when they didn't have the high path involved there. It also is a platform that we could potentially use for endemic diseases, and I'm going to speak to that a little bit with what our project is in Minnesota. Endemic diseases such as PED, Mycoplasma pneumoniae, or even PRRS could potentially be on a site-specific certification program. And probably one of the most important parts of what we're doing is we're developing a platform here with U.S. SHIP that allows the industry, the producers, to really drive the program. So even though this is going to be, the government is going to be running the program from their position at the USDA level and also at the state level, the people that are making the decisions about the resolutions and standards of the program are the producers and the people involved in the allied industry. And that's occurring through something that we're calling the House of Delegates. And that House of Delegates is meeting on an annual basis in September and making those decisions at those meetings as far as what the next steps are for certification. The program is to all different parts of the industry. So everybody, the stakeholders everybody that's in the industry is involved with that. It's a site-specific basis. It's ran by the state. So that's called the official state agency that monitors and certifies the sites that want to be enrolled in the program within the state. In Minnesota, the Minnesota Board of Animal Health is running that program under the direction of Dr. Eric Jopp and Dr. Brian Aves are involved with that and doing a great job of helping us get more and more farms enrolled and certified in the program right now. And that certification program involves 3 different pillars. There's a biosecurity pillar, there's a traceability pillar, and a sampling and testing pillar that are really the foundations of the standards that are reached by the producers that are involved in the program. Right now, we've got 38 states that are involved in the program, and you can see from the green marked states there, it's all the major hog producing states in the U.S. that are engaged in the program. Just a little update on where we're at with engagement right now. Nationally, we have over 70% of the inventory number of animals by USDA that's enrolled, and 60% is certified. In Minnesota, we're at 60% of our total inventory that's enrolled and 55% that are certified. So we have a little bit of work to do here, both within Minnesota and nationally. We'd really like to see those numbers get up to around 90% of inventory and of sites that are enrolled to really give us the base that we need to have for the program to be successful when we do, or if we do, get an incursion of a foreign animal disease. So the process is, if you're not engaged yet, is to get involved by contacting the official state agency, which is the Minnesota Board of Animal Health. They have a very simple enrollment form on their website that you can go to get enrolled. You complete that form, you send that in, and you are then enrolled with the information I'll give you in just a minute. Then you can pursue certification, which is a few more steps. And then once you're engaged in that, we ask you to stay engaged by being part of what's happening at the House of Delegates meetings, volunteering for that. Minnesota has, last year had 14 delegates that were part of the House of Delegates here in Minnesota, and just keeping informed of what's happening with the program. So here's the steps for certification, enrollment and certification. For enrollment, just 2 things you need. One is to fill out the form that shows who you are, the site, location, address, your PIN number, and demographics in regards to that, and then a sign of acknowledgement that you understand and comply with what the program is about. In order to be certified, there's a few simple steps that you have to show to the official state agency. You have to have a valid veterinary client-patient relationship. You have to show at one time 30 days of animal movement electronically, which is pretty simple to do with any different kind of system you may have in place for showing animal movements at the site. You need to maintain an SPS biosecurity plan that's available through the National Pork Board. Comply with the feed biosafety standards that are now in place. Those feed biosafety standards are very straightforward, very simple. They have to do with international feed mostly and how we're going to make sure that we don't have anything coming in through the feed internationally with the times that we have it isolated prior to bringing it to the site. Maintain the ability to meet testing requirements. Right now, there is not any testing requirements in order to be certified, but in the time of an incursion, we'd have to start doing more testing, and there's requirements that are going to be in the standards there for that in regards to what you'd have to do at the site. Then there is a 5-day downtime if you happen to have visitors coming to your farm from any country that's had a foreign animal disease such as ASF, swine hog cholera, or foot and mouth disease. So the draft rule programs, you can see if you QR code this, you can get the actual regulation to what has been submitted. USDA really can't comment on this during this time we're at right now. The comment period is actually passed and it's closed. We are waiting to hear from the Secretary of Agriculture whether an addition will be put in on a Federal Advisory Committee, which is called the General Conference Committee. It's very important, we believe, to continue to allow ground-up work through producers that are part of a central, like an executive committee that would help to make decisions that would drive our House of Delegates meetings and the standards that we want to have approved. Finally, then, at some point in time, with the wheels of government at a federal level, we expect to have this approved, and they'll publish a final rule, and then it will become a formalized U.S. ship program. We're holding our breath, waiting for that to occur. So the next House of Delegate meetings is set up for September 9th through 11th in Bloomington, Minnesota. And again, if you have been enrolled and certified, I'd encourage you to let some of us know at the Minnesota Pork Board if you're interested in being engaged in the process at that House of Delegates. The picture there just shows the way we vote. There's over 250 House of Delegate members from all the states, those 38 states that I mentioned, that have voting rights, and resolutions and standards are voted on in a 2-day meeting that we have there after they've been discussed. This is the website from a U.S. ship that if you want more information there, and I just want a shout out to both National Pork Producers Council and National Pork Board for not only their funding, but their support that they've given to the program through resources they have available there that's really helped the program and continue to support the program. The next thing I want to briefly talk about is our Minnesota Animal Health Task Force here in Minnesota. It's based on a pillar that the Minnesota Pork Board added about 2 years ago to their foundational statements, and that is that Minnesota will lead the nation in herd health improvement. It's a pillar that's all about animal well-being. It's a pretty big, hairy, audacious goal to be talking about leading the nation, and it kind of can draw the ire of sometimes of our competitors, quote-unquote colleagues in other states. But the reality is Minnesota has been a leader for a long time in many parts of pork production. And the whole impetus here is to continue to lead and grow stronger in how we lead in the area of herd health in the nation. So there's two things that we're looking at with the Minnesota Animal Health Task Force. First, again, is to increase producer participation in the U.S. SHIP program that I just talked to you about. But the second is to establish this task force that would facilitate progress towards the goal of eliminating endemic diseases within the state of Minnesota, and then potentially even moving that to a national level. Outcomes would be that eradication of endemic diseases, and then on just a full community basis. So we're looking at Minnesota as a herd of a whole, trying to reduce the burden of disease. So that looks at preventing and preparing for foreign animal disease, preventive care improvement, improvement in biosecurity, improvement in safe housing, and ultimately what we expect can happen from this kind of initiative is that it provides sustainable pork for generations within the industry in Minnesota with healthy pigs that support profitability and vibrant rural communities. And that's been our history. That's been our history in Minnesota, but the health is so important, and so we're trying to find initiatives that are going to drive that throughout the state. So how are we going about that? We're engaging with producers, veterinarians, academia, other pork producers associations, the Minnesota Board of Animal Health. All are engaged in that and are part of this Animal Health Task Force. There's currently 18 people that have volunteered to be part of that task force. They're listed here. We have met a few times now. Our initial meeting was to kind of develop our purpose and outcomes and building blocks, adjectives that we've arrived at to really describe what we're trying to do is to be proactive, to be collaborative, prioritizing for future generations, to be transparent in how we're doing things. And again, the quote that I've got here is that we want to become the premier pork producing state with the healthiest pigs and most sustainable practices, becoming a transformative example for the U.S. pork industry. It took a long time for us to get to that statement, but I believe it's a great goal to be moving towards as a state pork producer association. So when the Animal Health Task Force met, a decision was made to kind of look at the lowest hanging fruit that we may be able to tackle first, because we wanted to get specific and make sure that we've got some concrete things that are coming out of this. And the first thing we've decided to tackle is Mycoplasma pneumoniae. So we established that as our initial endemic disease to explore for possible elimination. It could be used, if it's successful, to be a template for other endemic diseases to reduce that burden of disease overall that we've talked about for the aggregate pork industry in Minnesota. And a subcommittee has been formed to develop a work plan for that, and has been in process now for well over 6 months to develop, and have started that plan of action. That plan of action includes establishing a baseline of mycoplasma high ammonia negative sow farms in Minnesota that I'm going to report on this morning, determine a long-term goal of what percentage of negative sow farms do we really want to get to at our baseline level, identify the benefits of negative status for mycoplasma, which is the cost of burden disease. Frankly, it's an endemic disease that many of us have dealt with, but sometimes it's at such a low level or at a level that is blurred by other things that we don't really understand the cost. And so for those that have not went negative yet, we've developed a spreadsheet. Dr. Paul Yeske, along with Dr. Maria Peters and one of her grad students, have developed a calculator that is available now through our website at Minnesota Pork Board to help people understand how they can reduce that cost through mycoplasma elimination. We then hope that we can eventually get to the point of a certification program within Minnesota that could be moved to a national platform such as the U.S. SHIP plan to leverage that across the industry and certainly leverage it across other pathogens in Minnesota also. So that the subcommittee has made a decision to contract through the Minnesota Pork Board with the University of Minnesota to initiate an ongoing surveillance of sow farms on their reported status. And that's what we're going to start with, is a reported status that they have. There's a three-pronged approach to that. We're going to start with people that are participating already in the Morrison Swine Health Monitoring Project at Minnesota. Then we're recruiting through veterinary practices within the state, and then looking to independent producers. And this is at a sow farm level that we're specifically looking for this to start with. This is work that's being coordinated and worked on by Dr. Corzo at the University of Minnesota, along with the help of others on his team there. The approach that he's using is, first of all, what I said is that it's based on what their presumed status is. So we're just making phone calls, making connections with them, and asking, what's the status of your mycoplasma in your sow farms? This is very similar to what's been going on within MSHIP for PRRS over the last years, and it gives us a good base to start from. So there's three phases to the data gathering that we're involved with. You got the MSHIP participants, then we're using the Pork Board website that Bailey Ruin has helped to develop that I'll refer to in a little bit, and then we're working through veterinarians. And here's what we've got up to this point. We've got 126 farms that are enrolled voluntarily in the survey. That represents 361,000 sows. Our USDA inventory is just a little bit, somewhere around that 500 million mark right now. So we're just under 75% of the Minnesota sow population that has reported the status of their mycoplasma at this point in time. That bottom histogram gives you a distribution of what size of sow farms they are. The largest bar in the center is sow farms between, that's up 57, I believe, that are in that is 2,000 to 3,000 sow herds size. But you can see that there's a nice distribution of sow farm size that represents the industry, I believe, really well right now where we're at in Minnesota. And this is where we're at as far as prevalence is concerned. There's out of those 126 herds, 113 of them are negative, and only 13 are reporting a positive status today. So we've got a 90% negative reported status of mycoplasma in our sow farms so far, and that's about 75% of our inventoried sows reporting that. There's 3 of those 13 herds that are undergoing closure right now, which should lead to a negative status on them. And I think this is really important, is that of the negative herds, 20 report that they've been negative for at least 5 years, another 20 have been negative for at least 4 years. The mycoplasma bacteria does not seem to move laterally from farm to farm very well. Dr. Yeske was involved in some work a few years ago that went out to prove that in finishers by taking negative pigs and looking at them downstream and see how many of those farms would go positive after they were negative at placement, and it's very few. That incidence rate is pretty small. And that's the good news about this, is that once these farms are going negative, a very high percentage of them are staying negative as long as we follow good biosecurity practice procedures on those sow farms. So the sow farms, just to give you an idea where they're located in their survey, this is a density map just showing where the population of pigs are in Minnesota, the darker blue being the more heavily populated counties within the state. And this is where those 126 sow farms are located. You can see they're distributed throughout the pork-producing counties of the state. And I think this is really good news, and it's back again to the lack of lateral transmission. Those 13 positive herds are located in 9 different counties across the pork-producing counties in the state. So it's not condensed in one area, for instance, of a Martin County or something like that that would have more pigs. It's moved through, it's all throughout the state, independently of where pigs are located. The next step for this is there's going to be a survey that Dr. Corzo is going to be sending out to participants to ask them to fill out about how they're determining their reported status. And the idea is to then take a subset and test and validate those farms also to make sure that we really do understand what our status is on this. So in summary, the presumed rate right now in sow herds is 10% of mycoplasma positive farms. 25% of those are undergoing closure right now to eliminate. The cumulative incidence, lateral introductions is very rare with a 1% to 2% cumulative incidence overall. And we're going to continue to gather data to make this program move forward and look at the next steps that are out there. So this is the website that Bailey has helped develop here that you can go to. There's a QR code up there for you that gets you to that place. Also a link there. You get to the landing page, and then from the landing page, you can actually fill out with your name and address information. You submit that, it goes to the University of Minnesota, and they will contact you to get your reported status. There also is a button on the bottom there, which is the mycoplasma calculator that I talked about earlier, that is very easy to go through. So if you're not sure about your mycoplasma status, you can use that calculator to determine if you have your data in front of you. It's pretty easy to fill out and see what the difference is between a positive status and if you went negative and what the expected results would be from that. One of the offshoots from the mycoplasma working group and the Minnesota Animal Health Task Force has been a resolution that we submitted last fall to the House of Delegates, and that was we requested the U.S. ship staff and stakeholders to work collaboratively with an established Minnesota mycoplasma working group to evaluate the next steps and a potential for a MHP health status certification within the U.S. ship. That has been passed, and that working group is now functioning with the same subcommittee here from Minnesota being part of that working group on a national level. So we've got all regions of the country involved and engaged in the process now, which I think is really, really good and important. And finally, the last thing I'll say is Dr. Oedekoven is up next. There's a lot of synergies between what we're doing at the Minnesota Animal Health Task Force and the National Swine Health Strategy Initiative that Dusty's going to talk about now. And it's our commitment to continue to communicate closely with the National Pork Board on those activities and make sure that we're aligning our strategies together. We think it's critical for the long-term success of the program. With that, I thank you. I think we're going to take questions after Dr. Oedekoven's presentation. So, Dusty?
Okay, good morning. Thank you for making time to attend the Minnesota Pork Congress this year, and especially for sticking around for this session on swine health. As Tom mentioned, Minnesota has a rich history of being a leader in swine health, and I just want to commend all of you for that. The rich history of taking swine health to another level, prioritizing that, and really being the leaders in that area. We know that swine health is critically important to the profitability and to the ongoing success of this industry. And so the National Swine Health Strategy has been developed as a producer-led initiative to improve swine health in the U.S. with two major guiding principles. One, keep foreign and emerging diseases out, and two, significantly reduce the impact of the domestic diseases that are affecting the bottom line of your farms every day. I'm Dusty Oedekoven. I lead the swine health team at the National Pork Board, and my team has been working closely with Dr. Anna Forsyth at MPPC and other experts in this area to build out the National Swine Health Strategy. And many of you may have participated in the development of this strategy through your engagement with our listening sessions, by taking surveys, or participating in one-on-one conversation with us as we've tried to understand what the significant concerns are affecting you related to swine health. And we've heard you. We know that swine health is having an impact on your businesses. We know that it is critical to the success of the future of the industry. And so today we're going to talk about how we got there, where we're at with the National Swine Health Strategy, the 2 goals and the priorities that follow along with that, and what you can expect as we begin to roll this out to the greater industry. So a little over a year ago, the National Pork Board conducted a survey. And what we learned through that survey from producers is that over 98% of respondents felt that swine health was critically important to the future of the industry. And that's not necessarily surprising, but it was an overwhelming response. We also had an advisement that was presented at Pork Forum last year, led by the Minnesota Pork Board, and asking for the development of a national swine health strategy. So with that advisement, we moved forward with gathering producer insights to try to understand those needs better. We gathered an advisory group who waded through all of that data and provided the 2 goals and the 5 priorities. And all of this is working towards the goal of one of the strategic goals in the National Pork Board's strategic plan, and that is improving the lives of our pigs and our people. So when we conducted those surveys and listening sessions, we got over 800 responses back. And a majority of those responses were producer responses, almost 600 responses from producers, and that's who we were targeting. We heard from producers across the range of production sectors in the U.S. The largest sector that we heard from were independent producers. We also heard from integrated producer packers, from the show pig sector, from contract growers, and from the niche and specialty producers. So really, we heard from the entire range. And what they told us was not necessarily surprising. In fact, the biggest response that we got was around PRRS. And for those of you that participated, we asked additional questions about what is it about PRRS that is impacting you? What can we do about it? But overall, PRRS was overrepresented as the #1 response that we got. Following PRRS, we had PED and foreign animal disease, also not surprising. These are major issues that the industry has. Other responses included on-farm practices, endemic diseases, influenza, biosecurity, strep, access to resources, and that response came primarily, not exclusively, from the show pig sector, and then E. coli. So you can see those were the top 10 responses that we got. And we heard comments, we have a whole database of responses that we got related to these, and just one that represents some of the sentiment around PRRS. All the normal things we do are not working. What are we missing? How are remote farms breaking? So as I mentioned, we had an advisory group comprised of producer leaders, veterinarians, and some state pork association executive directors. And they got together for a day and a half and waded through all of these over 800 responses that we got. And they helped to formulate 2 goals and 5 priorities. The first goal is keep foreign and emerging diseases out. This is an area that we've been very focused on over the last several years as we've helped to prepare the industry for African swine fever virus, and as Dr. Wetzell talked about, the development of U.S. Swine Health Improvement Plan, monitoring for ASF and CSF was one of the outcomes of those efforts, is supporting the development of the U.S. SHIP program. This is, ASF is still a concern. It's still a threat to the industry, and we can see with the recent outbreak of ASF in Spain that issue is still out there. Monitoring and early detection of emerging diseases is also continues to be important. But what was added here is a second goal, reducing the impact of domestic diseases. And as the advisory group deliberated over the day and a half, and of course dealing with this big elephant in the room, PRRS, they said what we want to do is eliminate PRRS. And that's a pretty tall order, right? I mean, that is a difficult task, and yet what it is, it's a clear destination with an uncertain pathway. But knowing that's where we want to get, we can work towards that. It's not a new idea. In fact, the American Association of Swine Veterinarians has had a policy statement in support of PRRS elimination for over 20 years. And I think what we're seeing here is a representation of industry support towards that effort. And that's really what we're trying to do, is coordinate the effort together. And by doing that, I think we can make progress. PED elimination was the second priority under the goal of reducing the impact of domestic diseases. I'm sure many of you remember when PED arrived here in 2013 and had a significant impact on the industry at that time. And since then, we've really learned a lot about preventing PED from spreading and how to eliminate it from a farm and how to eliminate it from a system. We actually know a lot about the transmission of PED, and I think we've heard and seen some good progress that Manitoba has made in eliminating PED with their program over a short time here. So I think PED is a much more near-term achievable goal that we can all work towards together. The final priority under reducing the impact of domestic diseases is reduce the spread of pathogens in the U.S. pork industry. And some of the sentiment that came in the responses that the advisory group looked at were, hey, we know we're moving diseases around. We're doing a lot of this to ourselves. We haven't had enough focus on biocontainment, keeping diseases where it is when it's identified, and trying to prevent the transport of those diseases. Not in all cases, but in some cases, we've got room to improve. And so this really centers around transport biosecurity and finding ways to share transparent information about site status and preventing the movement of disease. So what's next? Well, after we got those these goals and priorities, we sat down with our partners at AASV and the Swine Health Information Center, of course, Pork Board and MPPC, and we started to summarize all of the work that we know that's already been done in these two major areas with the 5 priorities. There's been a lot of good work done, a lot of research, a lot of information and resources available. Of course, the veterinary community has really been driving towards these efforts all along the way. And so we don't want to duplicate work that's been done, but we want to add to that. And we want to make sure that research initiatives are additive and that they can be focused on outcomes that producers can actually use to work towards these priorities. So there will be new work initiated and executed related to these priorities of disease elimination. We know that information sharing across the many different organizations and groups that will be working on this will be critically important. And we need to coordinate that industry research so that it's focused in outcomes that can help us achieve our goals. And ultimately, we're going towards that goal of healthier pigs and people. We've got a whole ream of draft tactics that have come together from this group. And these represent just a few of the prioritized tactics that we've worked on together. We're not starting at the same level with each of these priorities. For example, foreign animal disease, as I mentioned, is something that the industry groups have been very focused on over the past several years. We want to continue that. If you haven't got an AgView account yet, please sign up for an AgView account and enter your pig movement data. That's the industry-funded traceability program that you have that will help in the event of a foreign animal disease outbreak. We've got the Secure Pork Supply Plan, which Dr. Wetzell mentioned is a key piece of the U.S. SHIP program as well. So having a secure pork supply plan is still important. For those of you that have considered a certified swine sample collector training person within your system, that's still available. We want to still promote the ability to do surveillance in the event of a foreign animal disease. So those are things that we're going to continue to have ongoing and continue to support U.S. SHIP and the development of that program. We also have a really good track record of monitoring for emerging disease, and the Swine Health Information Center has really led the way in that, having their global disease monitoring reports and being alert to new issues like H5N1 avian influenza and what's the potential for that to transfer to pigs, and what would our response be if we were to have that show up. New World screwworm is another example of an emerging disease. So we have those things ongoing. As I mentioned, PRRS and PED elimination will be new work, and in both cases we're going to need to do some economic studies to understand what are the costs and the benefits of different approaches. We're going to have to develop a roadmap for PRRS elimination. With PED we're a little bit further ahead because, as Tom mentioned, there has been a PED elimination task force over the last 2 years led by the American Association of Swine Veterinarians, and that resulted in the adoption of a standard for PED clean herd status that you can now take part in now. The benefit and kind of the nice thing of that U.S. SHIP program is it's voluntary. And the certification is done by an official state agency. In this case, it's the Minnesota Board of Animal Health. And of course, you have the oversight of USDA over that entire program. So we've got a lot of good things going for us in the way of PED elimination, and I think we can fit in a coordinated approach to achieving that status. And then in reducing the movement of diseases, a lot of good work already done on the research side, and I think we just need to translate that to practical application on the farm. So what's next? Here are some things that you can expect, okay? We know that we need to do more communication, and we're planning to do quarterly communication. That's kind of a catch-all. Initially with states, we're going to be doing that communication to keep them updated on the status of our efforts, but I think we'll eventually see more communication across the research organizations and ultimately information that we can share with producers in a broad sense. We are making plans for a research summit as we start to do more research on these endemic diseases. We need to bring the research community together to share these priorities with them, let them know what our priorities and our goals are, and try to coordinate collaborative research projects that answer questions. We can have outcomes that yield real results on the farm. There's a need for economic studies, as I mentioned, to be able to put a cost with these approaches that we're planning out. And of course, we need to continue to do disease monitoring. Tom gave a really good example of what's being done through the MSHMP program relative to mycoplasma, and there are a number of other platforms out there that are monitoring for disease. We want to try to bring all of those together and find the best way to monitor for the current status, the incidence of disease, so that we can measure our success. And of course, we know there's a need for producer education and tools. And some of those we have, some of those need yet to be developed. And across all of these, there is a potential role for artificial intelligence to help us along the way and to help us do even more work than we're doing now. So as I mentioned, the National Swine Health Strategy is a producer-led initiative to improve the health of the U.S. swine herd. And together we're on the road to a healthier herd together. I invite you to scan the QR code to subscribe to the National Pork Board's weekly email, and that's one way that you can stay engaged with the process and the progress that we're making. And with that, Tom and I are available for any questions that you might have on either of our presentations. Good question. The question was, I'll just stay up here, sorry. The question was, what percentage of pig movement are recorded today within AgView? I don't know that I have the percentage, but I can give you an idea for the scope. We are seeing approximately in the range of 17,000 to 21,000 movements recorded per week. And as we've looked at that, we've estimated that may represent somewhere around 60% of the sow base and the movements associated with those. And so that's not bad for voluntary invitation to log your movements. I think we certainly have room for improvement there. At this point, there's no requirement to do that, and the benefits are simply to be ready for an animal disease response, should that happen. Other questions?
Yeah, great question. I'm going to repeat the question. The question, if I understand right, is on the reported status, how long are they considering themselves negative before they're reporting negative, number one, and how are they monitoring that and looking at it? And right now, I could tell you that I believe what our survey is going to show us is that a large percentage of these farms are farms that have went through elimination programs. And so there was a tremendous amount of testing that was done at the time they went through the elimination program to assure that they were negative. Since that time, there isn't nearly as much testing that's going on, but it's based on clinical science. Once these sow herds go negative, it's pretty evident if they start breaking that we're going to start seeing those signs. But I think that's going to be important information long term, and to decide is like what's going to be the time frames of should there be testing, if there's part of certification eventually, what are we going to do to make sure that we're truly reporting a negative status, and there'll have to be something that'll be in place on that. So those are all things that are in the future in regards to how do we do this? How do we do it in a way that's still economically feasible? This is true for all the U.S. SHIP programs, actually, is that we have to be very cautious about our approach of testing, because we don't want to put an extra burden on producers in regards to the cost of the testing programs that are in place. And so there's a lot of thought that goes into that. But I think the first step, to answer your question, is that we're going to do this survey to really try and understand what are people doing to make sure that they are negative, and how are they going to change that reporting system in the future. If they start hearing a cough, are they doing testing? What are they doing at that point in time to affirm whether or not they have the mycoplasma? Yeah, Paul.
Yeah, Tom, maybe it'd be good to go through the U.S. SHIP terminology of monitored and clean, and so that people understand that there's different levels, and there'll be different requirements based upon those levels, and all revolve around any clinical signs.
That's good. That's good. And it's good we got Paul here, because Paul is part of the PED. He was co-chair of the PED task force that actually a standard has been passed on that clean status now within the U.S. SHIP. So Paul can fill in the gaps of what I miss here on this. But actually, Dr. Yeski made a really good comment. He's part of our working group for mycoplasma just here recently, is that when we're thinking about these certification statuses and what we're driving for, we shouldn't let great get in the way of good. Okay, we want to take steps to make sure that we're improving the industry, and so that's where you have to be really careful about, and that's why there's actually going to be these two different classifications of monitored and clean. And so the clean status is going to be, in the PED, is going to be one, if I understand right, it's clean. There's significant testing based on protocols that are going to be in place that have to be done and have to be maintained on a regular basis in order to be certified as a clean status for PED. But we are in the process right now with the working group of working on what does a standard look like for attaining a monitored status. And a monitored status is going to be something at a different level than the clean status is going to be. So, Paul, I don't know if you want to expand on that.
And monitored can be positive or negative. So we wanted to make it so that everyone could participate. And certainly with PEDV, clinical signs are much more effective because they happen much more rapidly. And so, again, if you have clinical signs, you'll need to follow that up with diagnostics. That's one of the givens. And then at least an annual test is kind of what's being bounced around. We haven't come to the final, we have to be done by May, but we're still bantering back and forth. I try to put the producer hat on as we talk through the discussion, and the academics try and keep me on the scientific track of saying, this is what you've got to test. And so we're trying to find that happy medium, but the monitored, the clean is more what you'd think of like seed stock sales and the high health herds, and the monitored is really everybody else. And then those are also changeable over time. And so we don't have to have the perfect out of the gate. We can, as we make progress, as we move forward, we can be more stringent or less stringent as time goes forward. But again, we have to think about when I go to back to my clients and say, you've got 200 sites to monitor, that gets to be a lot of expense and a lot of work, and what can we do that makes sense but still gives us a good answer?
Yeah, the last comment I'd make on that is that it's so critical that this is producer driven. And so while there's a level of science that's pretty important here in how we go about developing these programs, we have to make them practical and feasible for you, the producers, to do. So you guys, your engagement, your involvement in the discussions and the development of the programs is critical for its long-term success. And again, these are all voluntary programs to remember. So that's very important too from an involvement standpoint. Yeah. Any other questions? All right, well, thank you. We appreciate your attention. We'll be around for a few minutes if anybody has any other questions they'd like to ask us. Thank you.